Social ecological model. My life as a patient care tech / nursing student via SEM. For the individual layer, I put a picture of my badge here because since I'm a patient care tech at Altman Hospital, I work on a neurosurgical step-down unit, so I put a picture of the nervous system here, just kind of symbolizing my knowledge in caring for patients with nervous system issues. The picture over here to the right just kind of symbolizes my want to increase my medical knowledge so I can become a better healthcare professional. And then down here is a picture of my textbook that I've used in nursing school pretty much since I started. This book has influenced a lot of how I practice because it has taught me so much of what to do in the healthcare field. Interpersonal, this first picture is doctors and nurses because these are my coworkers, people I work with every day. They influence how I practice a lot. And then the second picture over here, this is just a picture of a patient. My patients are literally what I practice for. They have a major influence on me. They're who I try to take care of, how I want to get them better. And then this picture down here is a picture of my family. It's a pretty old picture, but they have a major influence on me, especially getting through school and work. For the organizational layer, I picked the Joint Commission because this organization is responsible for making safety guidelines for healthcare organizations like the one I work in. And then the American Nurses Association is an organization that basically is all up to date on everything about nurses. So they influence me quite a bit as a nursing student because I have to follow a lot of their guidelines. And then this is a picture down here of Altman Hospital, which is the organization that I go to school at and I work at, and I follow their policies and guidelines that influence me quite a bit as a healthcare professional. For the community layer, this is a picture of Canton, Ohio. This is the community that I live in. So they influence me quite a bit. Altman, the place I work at, is in this community. I picked the Joint Commission as well because this organization is responsible for all the healthcare organizations in our community. The Altman Health Foundation. Altman is actually a foundation. They have multiple organizations throughout the community, so they influence our community and me quite as well. The Altman Ambassador Program. This is a program that's through the Altman Health Foundation, and one of their main goals is trying to improve health and health education for kids in the schools in our communities. For the policy layer, this is just a picture of a courthouse symbolizing legislative, since they have the power to make all the policies relating to healthcare. The Ohio Board of Nursing, they're responsible for making laws regarding to nursing, which is Ohio, the state I live in, so that's going to influence me quite a bit. The National Council of Nursing, this is a lot like the Ohio Board of Nursing, just a lot bigger of an organization, and they have more say-so, so their guidelines are also going to affect my practice quite a bit. All of these layers, they can all interact with each other and affect each layer. Kind of the further you go down, like the individual, the interpersonal layers, those can't be affected. They don't affect as much of the later layers like policy and organization, community, but layers in the community and policy, these can affect me quite a bit. Like these policies, they will affect me a lot in my knowledge, in my relationships, in my community in general. That will affect how I practice a lot and has a lot of influence on me. Alright, thank you.